can open case number 4 on your mobiles to see the history and examination and imaging.
Sir, are my slides visible, sir?
Yes, sir. Yes.
It's visible. Okay. So we are moving ahead with case number 4 now. He's 71-year-old gentleman with the known case of hypertension.
Your voice is less. Can you ask them to increase the volume?
Yes, sir. So is it better now?
Better. Better.
Okay, sir. So he's a 71-year-old gentleman with known case of hypertension with complaints of neck pain radiating to bilateral upper limb. His symptoms is more towards right side. He also have lower backache with the no radiation. On examination, there is no deficits and other reflexes are also normal. So on imaging, he got C5, C6 and C6, C7.
First show the X-rays. Yeah. There is cervical spine straightening is there on the lateral X-ray. Okay.
Yes. Sir, we can also note reduction height at 2, 3, 4, 5, 5, 6 levels, sir. On lower cervical disc, sir. So now going with MRI on sagittal cuts, we can also see straightening is there, and disc is prominent disc is we can see at C5, C6 and C6, C7 level. So disc is more central only, and his symptoms is more towards right side. He also got lumbar disc, but he does not have any radiating pain. So for now, plan I will hand over to Mike to sir.
Sorry, there is no back pain?
No. Sir, his symptoms are milder only, sir. He got backache, but there is no radiation, sir. His chief complaints are neck pain with the radiation towards right side mainly, sir.
Your volume is less, so we have. Chief complaint is cervical neck pain.
Yes, sir. Yes, sir.
But no back pain.
And with radiation to right side, sir.
Sorry?
With radiation to right side, sir.
Understood. But no back pain.
Sir, lower backache is there without radiation, sir. But it is mild only, sir. Occasionally.
Okay.
Sir.
All right. Can we have Dr. Dureja?
Yeah. Okay, now we are ready now.
Puranjay, please give the mic to Dr. Dureja so that we can discuss the plan with sir.
So, as you have seen the MRI and the symptomatology, which is neck pain radiating to the right upper extremity, a little bit of radiation to the left, but majorly to the right upper extremity. And he has some paresthesia also because of this radiation. There is no sensory deficit, a little bit of sensory in terms of paresthesia, but there is no motor deficit. So we checked all the reflexes, biceps, brachioradialis, deltoid, everything is.
Please, no crosstalk here, please.
Pardon?
Sir, continue, sir.
Sorry. So, no motor deficit, and his radiating pain is troubling him for a long time. And as you can see from the MRI that there is a lateral recess compression of the nerve, and it is essentially the radiculopathy which is troubling. So, as we were discussing in the morning, we have abandoned the cervical root sleeve block which we were doing about 20 years ago because of the spinal artery being very close to the nerve. So we are doing a cervical epidural, and as we will demonstrate, you have a fairly good spread along the nerve roots. So this is a C5, C6, C6, C7 disc bulge. So we will be going from C7 T1 interspace. Can we have this C-arm, please? Any questions so far?
Sir, here the spread will be upwards.
The spread will be laterally and upwards.
Okay.
Because I want C6, C7 and C4, 5. Right. The spread will be upwards.
And again, do you sedate the patient?
Yes, we do. We do give midazolam 2 milligram.
Okay, sir.
And that's it. Because you give local anesthetic and patient is quite comfortable. But yes, midazolam has to be given. Right. And you can see the position of the C-arm.
Yes.
You square off, and we have squared off. It is little corded. The direction is a bit corded. And you can see the interlaminar space where we have already given local anesthetic. Right? Push, please. You will add the C7 T1 interspace. So we have to hold the head properly so that the patient doesn't move during the procedure. So somebody will be holding the head.
So you're giving in midline, sir?
Yes, this is interlaminar,
Right, sir.
always interlaminar.
So C7,
T1.
D1. Right, sir.
आपको जी 5 मिनट के लिए पोजीशन बस, हाँ नीचे कर लीजिए सर. अब हिलाइए मत, हाँ हिलाइएगा मत. Yeah. So we use a special epidural set. एक मिनट दिखाइए इधर, कैमरा प्लीज खोलिए. ये दिखाइए, इधर दिखाइए. Yeah. So this is a special Portex epidural set which has a catheter, which has a needle. यहाँ पे ड्रॉप कर दीजिए. यहाँ पे ड्रॉप करिए. So this is a loss of resistance syringe with which we see the epidural space. This is the needle. If in case required, we have a catheter, we have insertion of this. So if the dye is not moving up to the desired, you can use a catheter. So this is a standard 2He needle, 18 gauge,
Okay.
which we are going to use. And this is the syringe which will help us in finding out the epidural space.
Understood, sir.
Right. Okay. So we are proceeding. हिलेगा मत जी प्लीज. शेखर आप ही कर दो ना. ठीक. चेक.
PIP में एक्सरे दे दो.
ठीक है जी. तो my needle is directed little bit on the right side. As you can see, I am putting on this syringe, loss of resistance syringe. Check. Check please. So I am going middle right side. So now I have reached the ligamentum flavum. Check please. I can feel the ligamentum flavum. So now I have to be very careful. Yes, that's the loss of resistance. Okay? As you saw, I am showing you again. There was a bounce back, there is no bounce back.
Right,
check,
sir.
check please. Yeah. So my needle is purposefully directed towards the right side, and we are now going to show you the position of the needle in underlateral. आप हिलेगा नहीं. So we are in the epidural space on the right side because we want to bathe the right-sided nerve roots starting from C6 to C4. We check it in the lateral position vis-a-vis the position of the needle in the epidural space. The syringe is used for identifying the space. Ligamentum flavum is the feel which you have to have. With experience, you have to have the feel of that, because there you have to be fiber by fiber, cutting the ligamentum flavum with the needle fiber by fiber, because if you do a thrust, then you can enter into the dural space, which is not desirable because the spinal cord lies there, unlike lumbar area. So you have to go fiber by fiber. As soon as it's a thinner space, थोड़ा सा height down करो. हाँ. The shoulder will be coming in between. ये आ रहा है, ये हाँ. और नीचे जाओ, दिखाओ. शोल्डर आ रहा है बट थोड़ा सा ऐसे oblique. Yeah. दिखाओ. ठीक ठीक. So we are just So we are just trying to show you in the lateral view. Yeah. ये बीच में वो आ रहा है. थोड़ा सा ऐसे और जा. नहीं और जाओ ना यार, lateral जाओ, और जाओ, और जाओ. आप दिखाओ अपनी तरफ लो अरे यार लैटरल में हाँ आप दिखाओ यस और दिखाओ so
Sir, in
now
lateral view, how you avoid shoulder overlap?
you have to remove you have to take the shoulder below the hands below but at this level the shoulder generally obstructs us.
Yes, sir. Because
We are
many of
inside.
the patients,
If-
especially if short neck is there,
Ji.
you won't be able to see
You
at
won't be
this
able to
level.
see. So, yeah. So now the time to see the spread of the drug. Shoot please. इसको अभी AP view करिए फिर से अब मेरी तरफ लाइए AP view. Yeah. So now again after aspirating I am giving my dye. ये dye है ना? Show please. Yeah, now you can see the spread. There are some vacuolated areas because of the air which we pushed in. And now I will again. So the dye is preferentially going on the epidural space on the right side. And I am giving local anesthetic to show you no, not local anesthetic. Sorry, no local anesthetic, only saline.
Sir, what is the possibility of puncturing dura during this needle insertion?
See, basically, as I said, now you can see the roots. The ligamentum flavum, feel of that ligamentum flavum is important. So there is an empty space, then you have the ligamentum flavum. There you go very, very slow. It is narrower than the lumbar space, the epidural space.
Okay,
But
sir.
with experience, the incidence is very low, but it can happen. But if you should not be very violent to go deep in. Show please. And now I'm going to show you the roots. Yeah, you can see the roots now. You can see the C7 root. You can see the C6 root. Can I have some more dye, please? More dye.
That means while passing the needle, you have to move very, very slowly and feel the tissue.
Absolutely. Absolutely.
That is the crux of this technique.
Yeah. Yeah. Shoot, please, shoot. I'll put some more dye. Yeah, you can see the roots now. This is the C7 root. Then you have the ऊपर वाला जाइए. This is the C6, C5. This is the C5. There are lots of electrodes which are hanging in between. I'm putting some more dye for you. Check in, please. Check, please.
Till higher up, till what level can you see
You
by
can
injecting this?
See now the roots can be seen beautifully. Can you show these roots? Yeah, this one. This on the other side also, on the left side also. Yes. Putting in more dye has shown. So you can put a catheter and go up to C1. Why not?
Yes, sir.
Anywhere. Show please again. Show please. Now you can see the roots on the left side, roots on the right side. The desired area was C4, 5, and I can see the roots on both the sides. Right? Any questions? The same drug, 80 milligrams of triamcinolone, which I am going to give. Okay? This is 80, no?
You said, sir, again same thing, 20 mg triamcinolone.
Yeah, here it is not root, no? It is epidural, so I am giving 80 together so that it bathes all the nerves.
Okay, understood.
Can you
This
check,
is
please?
full
check.
2 ml of
2
dopamine.
ml of, yes. So you can see now the drug from the epidural space has migrated into the roots only. So that's why the root block which was done earlier has been abandoned, because you can beautifully see this. So why take the risk of puncturing the spinal arteries? Right? For the sake of showing you, I can even put a catheter. So this is the catheter which we use, and so I'm putting a catheter. Catheter is in now, and we're going to connect it. We have the dye. No. No. No, high volumes are not required. Just about 2 to 3 ml is required. So with this filter, with this connector, catheter is inside, and I'll show you this catheter also. Check, please check. Yeah, you can see now the catheter is moving on the right side. Check, please check.
So this catheter has
Yeah.
gone down or
No,
up?
it's gone up, gone up.
Okay.
You can see it's gone up, right up to C1 now, C2. Yeah. Preferentially on the right side it is going. Yeah. 40 milligram.
Sir, we are not able to make out where is the catheter. Can you highlight it?
Okay. Continuous करोगे, continuous
Is it
करो,
a radiopaque thing?
continuous
or,
करो. No, it is not radiopaque. Continuous करो. Yeah, that's the catheter.
Is there any mark, dot or mark, or what is there?
No.
how we
This is not a radiopaque. We have radiopaque catheters, but this is not. So the dye spreads, but it goes rightly. If you can see, the dye is spreading right from this place to this place and going down. I don't know whether you'll be able to appreciate there.
we are not able to appreciate
Yeah,
it here,
yeah.
sir.
Check, please, check. Yeah. No, you can see the catheter probably. Yeah, this. Yes. So he does have some symptoms on the left side also, which we can take care.
And like the catheter has gone up, had you directed the bevel upside?
Yes.
And can we do
Yeah,
this for the down also?
The bevel is always directed up. If you want upper segment, you can direct it down. Put a catheter, it will go up to thoracic 6, 7, 8 also
Okay, sir. Okay, sir.
from this level. Okay?
Okay, sir.
So we take
And,
out the
this,
catheter.
This entry point is the standard for all cervical epidurals, or
No, you can go.
You can tailor it up or down.
You can
as-
tailor it up and down, but the favorite sites, the easiest sites are C71.
Okay.
You can go C6, C7 also. Sometimes C4, 5.
Because
But-
it's easier to identify
Yeah,
C7 prominent.
Yes,
spinous
identify
process.
also, and the interlaminar space is quite big.
Yes, sir.
In the upper segment, this is very narrow.
Yes, sir. Yes, sir.
Yeah.
Thank you, sir. Any questions
No,
from the audience?
only
Yes.
if it is not going up. If it is going up, there is no need. I just wanted to, just for them.
Dr. Dureja,
Ji,
one question that in this case you did not give Xylocard after
No.
the
yes. No,
steroid.
generally we don't give because we don't want to do a motor blockade of the cervical nerve roots. They are important roots, so I don't want to cause any motor
Right.
deficit.
Right.
So specifically, it is an epidural. So even if I give 2 ml, it can cause some motor deficit.
Right.
So I
Thank you, Dr. Dureja.
Thank
Thank
you.
you.
Regarding complication of this